I mean, look, we've seen it all before, haven't we? These unlinked cases. So, it could turn out to be quite a problem. But what's really promising is that the vaccination rates are high and growing every day. And I think that really, we've got evidence to show that really stops the transmission. So I think we're going on we're in a different path than what we were about 6 months ago with no vaccination. So it's looking better than what we fear, I would say.
I was interested to see that the Premier, Anastasia Palaszczuk, was quite quick to talk about potential, and I say potential, lockdowns in the Gold Coast. Do you think that's the right approach, warning of potential lockdowns when you've got such low numbers?
I think that the Premier is doing what she can to protect the state, and as we all know, schoolies is coming up on the Gold Coast. So the days surrounding these unlinked cases are very critical, and we've seen that in the past. So we need to get on top of it now. We need people to go out to get tested. We need people to make sure they're getting their vaccines when they're eligible for them. I think she's said what she said because she doesn't want any surprise lockdowns. It's just preparing people that if they don't get it under control earlier, then there might have to be further restrictions.
What do you think could trigger a lockdown?
It's just going to be increased case numbers, particularly if you've got increased case numbers with those who are unvaccinated, because we know the unvaccinated are at a far greater risk of spreading it because they have high viral loads. So if we were to see that, then I think that would be worrisome.
Well, we know the borders are coming down, as we mentioned in the introduction there. How do you expect the outbreaks to be managed? What do you think the tolerance level will be for case studies?
Look, that's the million-dollar question, isn't it? Like in Queensland, we haven't had that uncontrolled case numbers since the very beginning. So we've been very lucky, very fortunate. People have done all the right things. How this then rolls out when we open our borders, time is going to tell. But all I can say is that the power is with the people. If we've been through this for almost 2 years, we know how to limit transmission. We know how to protect ourselves. We know how to protect our loved ones, and we need to continue to do that because. It doesn't matter what, COVID-19, COVID's coming, and we know that people will die from it. So let's minimise that impact. Let's wear face masks when we need to. Doesn't matter what the mandate says. Get vaccinated, keep social distancing, and use what is now termed common sense. This is infectious disease common sense that we all have.
I'd love to know, I mean, you're working in these hospitals. Are they ready for any outbreaks, given that you are about to see fluid travel between the borders?
Are they ready? They're as ready as they can be.
Is that enough, though?
Well, without knowing how quickly this expands in our community and how sick people get, it's impossible to know if we're prepared properly. I would say that we are prepared to the best level that we can be, but we would still ask the community to please get vaccinated, because if you're vaccinated, the data is there. You're very unlikely to require hospitalisation. And this is, the bottleneck will arise if we have so many cases so fast that our hospital systems have to do all they can to cope. And that often means, funneling away beds or facilities or manpower in terms of healthcare workers to help COVID patients, where they might need to help car crash victims or, people undergoing severe treatments for cancer that might have bad side effects, or, other unexpected things that happen in the community, which all healthcare workers are there to help. So just if we can slow that spread so that our system can cope better, we'll all be better off for it.